Westminster for us this morning. Now, hello to Mr. Eustice. Thanks for taking the time to join us this morning. How worried is the government about the growing number of COVID deaths?
Well, look, obviously, we've been monitoring the incidence of this disease, and it's why a number of weeks ago we strengthened those restrictions, why we've been introducing new restrictions in some of those northern towns and cities where there's been an early spike. And we know that mortality very sadly tends to follow those spikes in incidence by a number of weeks. It may be that we've started to see that yesterday. So obviously we're monitoring it very closely. We are concerned. That's why we continue to introduce new restrictions where that's necessary, including, for instance, in Warrington yesterday.
The virus seems to have crept up on us again. Whose fault is that?
I don't think it's crept up on us. We've known that this is a virus that's likely to return in the winter. That's why we've been monitoring infection rates very closely. It's why we established over the summer that test and trace system, where we're now testing over 300,000 people per day. And we've been monitoring these trends really over the last 6 weeks and recognizing that this is rising and taking steps wherever we can to dampen the spread of the virus.
OK, but we did encourage people to go out and mingle and eat together, didn't we, in August? 2 months later, we've got a second wave that's even worse potentially than the first.
Yes, but look, this is a virus that spreads, and if people are infected, they tend to show symptoms between 4 and 10 days. We didn't see a spike during the summer when we eased those lockdown restrictions, partly because it was in the summer. You had long days, warmer weather, not conducive to the spread of the virus. We started to see an uptick in the virus in September. We monitored that very closely and started to reintroduce, therefore, restrictions later that month. And we've been refining those ever since with targeted steps. I mean, this is a virus that spreads during winter months, and it's a difficult situation, obviously, to manage. But I think we're taking the right approach, and where we've acted, we've seen the incidence of the disease start to dip back down. So we're dampening the spread of this virus, but obviously it's a very difficult situation to control completely.
Yeah, although SAGE, I think I'm right in saying, did advise the government on the 21st of September that unless stronger action was taken in the form of a national lockdown, that we would be seeing 200 deaths a day by mid-November. We're way past that already. How concerned are you? And really, should you not have listened to SAGE when they told you?
Well, we did listen to SAGE, and I read that SAGE advice at the time, and they set out a range of options. One of them was a circuit breaker lockdown, as it was called, for a couple of weeks, where you had a complete lockdown across the whole country. They themselves ventured that the impact of that would be uncertain. We know what lockdown did in March and April as we were going into the spring and summer months, but it was less certain what it would do as a short term blocker in that way, and there would also be many other impacts which they acknowledged. So they set out a range of different options, and we did follow some of those in the end. So we followed those the three-tiered approach we've taken now, with more localised lockdowns where we've got hotspots, and I think that's the right way to approach it.
Is it something that you will consider now, a circuit breaker lockdown for the whole country?
Well, we've set out our current position, which is these 3 levels of alert. Areas that have got a low incidence effectively just have to abide by the rule of 6 that was set out in September. We then got the middle level, which obviously now affects many parts of the country, including the North, the Midlands and London, where actually you can't mix in 2 households in a closed environment, and that's a further step. And obviously then we've got those even tougher measures in the real hotspots in parts of the northwest and some of those other northern towns. We think that's the right approach. That's the approach we're going to stick to. But look, the Prime Minister and the Health Secretary have made clear all along that we keep all options open. This is a dynamic disease, a fast-moving situation. We have to monitor things very closely, and that's why we can never rule anything out. But we think we've got the right approach for now.
If you don't impose another national lockdown, then more people, hundreds of people a day, will undoubtedly die. Who will be responsible for that?
Well, look, government takes responsibility for setting the right approach and the proportionate approach to the level of the challenge we have. And this is an extraordinarily difficult pandemic that governments right around the world are wrestling with. We've learned quite a lot more about this virus since March, and that's why we think we've got the right approach now to strike that balance between understanding the impacts of being shut down and told to stay at home on people's mental health and on the economy and on people's jobs and prosperity, and also the importance, obviously, of checking the spread of the virus. We think we've struck the right balance on this, but it isn't an easy situation, and no one pretends it is.
Indeed not, but I pose my question again. If you don't have another circuit breaker lockdown, or if you don't have a lockdown in England, as we've seen already taking place in Wales and in other European countries, hundreds more people will die every day. Who will be responsible for that?
Well, I'm not sure you can reach that particular conclusion, because what we actually have in some of those northern towns and cities is something very close to a lockdown. And we've learnt a lot about what steps can check the spread of this virus. You're never going to stop it spreading entirely. Even in lockdown, it continued to spread to a certain extent. But we've learnt a lot about the areas and the venues and the types of social mixing that can be conducive to the spread of it. And we're acting to dampen that so that we can control the spread. Government always takes responsibility for the approach that it takes on any policy matter, including this one, but I think we've struck the right balance.
What does Christmas Day look like for my viewers in England at the moment?
Well, the Prime Minister's been very clear, as we all are, that we want people to be able to celebrate Christmas in a way that's as close to normal as possible. But it is too early to be able to say exactly what the situation will be come Christmas and exactly what different parts of the country will or will not be able to do. Obviously, checking the spread of this virus is paramount. But alongside that, we want people to be able to live their lives as close to normal as possible, including at Christmas, which is an incredibly important time for families.
Are you going to help with feeding children at Christmas via the free school meals?
Well, look, we've taken a view that free school meals are for term time. That's always how that particular intervention was designed, and that's why we're no longer going to be offering free school meals during the school holidays. But alongside that, there are many interventions that we've had to support people who are struggling to afford food. We gave £16 million through Fair Share, which is a government-linked programme to get food to charities. We gave £63 million to local authorities. We've increased universal credit by £20 a week. So there's a package of measures we put in place to help those who are in poverty and perhaps struggling to afford food. And I think that more targeted intervention is the right way to go.
Yeah, the £63 million in central grants. We spoke to the leader of Nottingham Council yesterday. He said you were double counting as far as that was concerned. The £20 a week with universal credit, that's only until next April, and then it will at this stage be abolished. 1 million people have signed a petition that has been put forward by a footballer, Marcus Rashford. He wants more kids to be fed. He thinks they deserve to have food when they're not in term time. How can you possibly think that it isn't appropriate?
Well, I think it is, because the free school meals voucher system is always one for term time. That is about giving free school meals to children in need during term time, not during the holidays. We know, if you look at the evidence, that household spending, if you look at the poorest 20% of household spending on food has actually gone down from about 16% 10 years ago, 16% of household income down to 14%. So people are actually spending proportionately less of their income on food. But nevertheless, it is the case that there are people, particularly if they have an episode in their life or a breakdown of the car or something, and they can't afford things, then that inability to afford food is what presents itself first. And the way to address that is through these targeted hardship payments that we've done through local authorities, through supporting other food charities in the work they've been doing during the pandemic, and obviously through the benefit system. And that's that uplift on the universal
Well, we've
credit
just been talking about the benefit.
Yeah, does
go on.
run till April,
Yeah.
and obviously things can always be reviewed.
So is that going to be reviewed?
Well, all things are reviewed when you have a budget and a spending review, which will be coming up. But
Okay.
for now,
Okay,
the
fine.
universal credit,
Fine.
that £20 uplift is
Okay.
there until next April.
Okay, so you're quoting percentages at me about, what people are spending on food. There are kids in the UK going hungry because it's not term time. You're saying you'll feed them in term time, but they'll have to go hungry when it's not term time. Can you appreciate, Minister, how ridiculous that sounds?
I don't understand the point you're making, really, because this is free school meals, and it's
Kids are going hungry when they're not at school. I mean, I can't make it any simpler than that, Minister.
Well, and the way that we are addressing that, as I said, is principally through that significant increase in the universal credit, a £20 per week increase, so that people have the money to buy food for their families. That's the right way to address this. And through other interventions, such as those hardship payments for local authorities, where we've given 63 million, and other money as well to other food charities for the good work that they do right across the country. So we've put a package of support in. Free school meals has always been a scheme and a support scheme that's for term time. It's run by schools during term time.
Yeah, but we've not been in a pandemic in our lifetimes before, have we, Minister? And that's making the situation even more challenging. You want to talk to me about maritime protection today? We've got a few minutes if you'd like to discuss it.
Yes.
Go on.
That's what marine protected areas, you mean?
Indeed.
Yes. We've got around our coast some nearly 40% now of our waters are protected areas, and we've launched a consultation today on 5 of those areas, including the Dogger Bank, to look at measures to improve the management of those sites to prevent harmful activities that might damage some of the features there. And this is something that is possible now under the powers of our new fisheries bill. Now that we've left the European Union, it's possible for us to take direct control of the types of measures and restrictions that are needed in our waters in a way that we weren't able to previously.
OK, just before I let you go, Minister, if I may, writing in The Lancet, the chair of the UK's Vaccine Task Force, Kate Bingham, says the first generation of vaccines is likely to be imperfect, and we should be prepared that they might not prevent infection but rather reduce symptoms, and even then might not work for everyone or for long. What's the government's response to that this morning?
Well, look, Matt Hancock has been clear all along that a vaccine will be the answer at some point, but it is too early to say precisely when that vaccine will come. And I know there's some hope that there might be something as quickly as Christmas, but, that's not by any means a certainty. And it's also the case that it's always with a vaccine, you don't know precisely what level of protection it will deliver. Some of them deliver full protection, some don't. And so I think the analysis is probably right, that it's a huge amount of very good work going on vaccines. It will at some point be the answer to this terrible situation that we're in. But there's always a lot of doubt and uncertainty with vaccines. Yeah.
How challenging is it for you? You know, because you come on our programme, we really appreciate it, we beat you up, and then you go and talk to other broadcasters who do the same thing. But you go into politics to try to make a difference, I understand that. How challenging is this virus for you? It seems to be going on and on and on.
Yeah, it's deeply frustrating, and yes, of course, challenging for politicians and governments who have got other agendas that they want to be getting on with, and this obviously soaks up an enormous amount of time. But look, that's immaterial. We come into politics, we know what happens, that problems arise on our watch, and you've got to get on and deal with them. The real concern here is the impact that this is having on our country and on potentially on the economy and on people's well-being and mental health. That is what we're most concerned with, and that's why we're working hard to make sure we get the response to all of this right.